Are you worried about the sneaky threat of colon cancer? Don't miss out on this potentially life-saving information that could protect you and your loved ones. Make sure to watch until the end for an exclusive bonus tip that you won't find anywhere else. Colon cancer is a formidable adversary, ranking as the third most common cancer worldwide. But here's the good news. Early detection can make a huge difference in treatment outcomes and survival rates. That's why it's absolutely crucial to be aware of the subtle warning signs your body may be sending you. In this video, we'll dive deep into the top 7 colon cancer symptoms you should never ignore. These red flags could be your body's way of telling you that something isn't quite right. By recognizing these symptoms and taking swift action, you could catch colon cancer in its earliest stages when treatment is most effective. Now let's kick things off with the first symptom on our list. 1. Persistent changes in bowel habits. One of the most telltale signs of colon cancer is a persistent change in your bowel habits. This could manifest as diarrhea, constipation, or a nagging feeling that your bowels aren't emptying completely. If you notice these changes sticking around for more than a few days, it's time to have a chat with your doctor. Recent studies have revealed that over 50% of colon cancer patients experience alterations in their bowel habits. Don't brush off these symptoms as mere digestive woes. They could be a red flag for something more serious. Pay close attention to the frequency, consistency, and comfort of your bowel movements. If you're constantly running to the bathroom or feel like you can never quite empty your bowels, it's worth getting checked out. It's important to note that everyone's bowel habits are different. What's normal for you may not be normal for someone else. That's why it's crucial to be in tune with your own body and notice any significant changes. If you're unsure whether your bowel habits have changed, try keeping a journal to track your movements. This information can be incredibly helpful for your doctor when determining if further testing is necessary. But before we move on to the next symptom, make sure to smash that like button and subscribe to our channel for more life-saving health content like this. Your support helps us continue to bring you the latest research and expert advice to keep you and your family in tip-top shape. 2. Blood in your stool. Another alarming symptom is finding blood in your stool. This could appear as bright red blood or a darker, tarry substance known as melena. While hemorrhoids or anal fissures can also cause bleeding, it's crucial to get any rectal bleeding evaluated by a medical professional ASAP. Research indicates that blood in the stool is the most frequently reported symptom among colon cancer patients. Don't let embarrassment stop you from seeking help. Your life could depend on it. Whether it's a small amount of blood or a more significant quantity, any rectal bleeding warrants a trip to the doctor's office. It's worth noting that not all blood in the stool is visible to the naked eye. In some cases, blood may be present in such small amounts that it can only be detected through a fecal occult blood test, FOBT. This simple, non-invasive test can be done in the comfort of your own home and is often part of routine colon cancer screening. If you're due for a screening or have any concerns about blood in your stool, talk to your doctor about whether an FOBT is right for you. 2. Abdominal pain and cramping. Persistent abdominal discomfort, including pain, cramping, or bloating, could be a warning sign of colon cancer. As the tumor grows, it can obstruct or inflame the colon, leading to these uncomfortable symptoms. Studies have found that abdominal pain is reported by up to 44% of colon cancer patients. If you're experiencing ongoing discomfort that doesn't seem to go away with over-the-counter remedies or lifestyle changes, it's time to talk to your doctor. Keep track of the location, intensity, and duration of your abdominal pain, as this information can help your healthcare provider make an accurate diagnosis. It's important to remember that abdominal pain and cramping can be caused by a variety of factors, ranging from gas and indigestion to more serious conditions like inflammatory bowel disease, IBD, or appendicitis. However, if your pain is severe, persistent, or accompanied by other symptoms on this list, it's crucial to get it checked out. 4. Unexplained weight loss. Sudden unexplained weight loss is another potential red flag for colon cancer. As the cancer progresses, it can affect your appetite and your body's ability to absorb nutrients effectively, leading to unintentional weight loss. Research shows that unexplained weight loss is a common symptom, with up to 37% of colon cancer patients experiencing it. If you're shedding pounds without making any conscious changes to your diet or exercise routine, it's worth getting checked out. Keep a record of your weight changes and any accompanying symptoms to discuss with your doctor. It's important to note that unexplained weight loss can be a symptom of various health conditions, not just colon cancer. However, if you're losing weight rapidly and without trying, it's always best to err on the side of caution and talk to your healthcare provider. They can help determine the underlying cause and develop an appropriate treatment plan. 5. Fatigue and weakness. Persistent fatigue and weakness can be another indication that something is amiss. As the cancer grows, it can lead to anemia, a condition in which your body lacks sufficient healthy red blood cells to transport adequate oxygen to your tissues. This can leave you feeling exhausted and weak, even after a full night's rest. Studies indicate that fatigue is a prevalent symptom, reported by up to 74% of colon cancer patients. If you're struggling with ongoing tiredness that doesn't improve with rest or lifestyle modifications, it's time to consult your doctor. Fatigue can be a symptom of various health conditions, so it's essential to get a proper evaluation to determine the underlying cause. It's worth noting that fatigue and weakness can also be side effects of cancer treatment, such as chemotherapy or radiation. If you're undergoing treatment for colon cancer and experiencing these symptoms, be sure to talk to your healthcare team. They can help you manage your symptoms and maintain your quality of life during treatment. Next, narrow or ribbon-like stools. Another potential warning sign of colon cancer is a change in the appearance of your stools. If you notice that your stools have become narrower or have a ribbon-like shape, it could indicate a tumor obstructing the passage of waste through your colon. Research has shown that narrow stools are a less common but still significant symptom of colon cancer. If you consistently experience thin, pencil-like stools or notice a change in the caliber of your bowel movements, it's important to bring this to your doctor's attention. This symptom, in combination with others on this list, could be a strong indicator of colon cancer. It's important to remember that narrow stools can also be caused by other factors, such as dehydration or a low-fiber diet. However, if you're experiencing this symptom along with others on this list, it's crucial to get it checked out. Your doctor may recommend a colonoscopy or other diagnostic tests to determine the underlying cause. 7. Feeling of incomplete evacuation. Finally, a persistent feeling that your bowels haven't emptied completely, even after a bowel movement, could be a sign of colon cancer. This sensation, known as tenesmus, can be caused by a tumor in the rectum or lower colon, which prevents the complete passage of stool. Studies have found that tenesmus is reported by a significant number of colon cancer patients. If you consistently feel like you need to have a bowel movement, even after you've just had one, it's important to discuss this with your healthcare provider. This symptom, along with others on this list, could help your doctor determine if further testing is necessary. It's worth noting that tenesmus can also be a symptom of other conditions, such as inflammatory bowel disease, IBD, or hemorrhoids. However, if you're experiencing this symptom along with others on this list, it's crucial to get it checked out. Your doctor can help determine the underlying cause and develop an appropriate treatment plan. Now, as promised, here's your exclusive bonus tip: the importance of screening. Colon cancer screening tests, such as colonoscopies, can identify precancerous growths called polyps before they transform into cancer. By detecting these growths early, they can be removed, significantly reducing your risk of developing colon cancer. Experts recommend that adults aged 45 and older undergo regular colon cancer screening. If you have a family history of the disease or other risk factors, your doctor may advise starting screening earlier. Don't wait for symptoms to appear. Proactive screening can catch colon cancer in its earliest, most treatable stages. But here's the thing: many people avoid colon cancer screening because they're afraid of the procedure or the preparation involved. Let's set the record straight. While the prep may be a bit uncomfortable, the actual colonoscopy is usually done under sedation, so you won't feel a thing. And the peace of mind that comes with knowing you're cancer-free, that's priceless. So, if you're due for a colon cancer screening, don't put it off any longer. Talk to your doctor about scheduling a colonoscopy or other recommended screening test. It could be the difference between catching cancer early and facing a more difficult battle down the road. All right, health warriors, let's recap what we've learned today. The top 7 colon cancer symptoms to watch out for are: 1. Persistent changes in bowel habits. 2. Blood in your stool. 4. Abdominal pain and cramping. 4. Unexplained weight loss. 5. Fatigue and weakness. Narrow or ribbon-like stools. 7. Feeling of incomplete evacuation. If you're experiencing any of these symptoms, don't panic, but don't ignore them either. Schedule an appointment with your healthcare provider to discuss your concerns and determine if further testing is necessary. And remember, regular colon cancer screening is crucial for catching the disease early when it's most treatable. Don't let fear or embarrassment stop you from taking this important step in protecting your health. Before we wrap up, let's talk about the power of prevention. While we can't control all of our cancer risk factors, there are steps we can take to lower our chances of developing colon cancer. Eating a diet rich in fruits, vegetables, and whole grains, maintaining a healthy weight, exercising regularly, limiting alcohol consumption, and avoiding tobacco use can all help reduce your risk. But the most important thing you can do, listen to your body. If something doesn't feel right, don't brush it off. Your health is too important to ignore. So, health warriors, let's make a pact. Let's commit to being proactive about our colon health. Let's educate ourselves, listen to our bodies, and take action when necessary. Together, we can fight back against colon cancer and live our healthiest, happiest lives. If you found this information valuable, please give this video a like and share it with your friends and family. You never know who might need to hear this life-saving message. And if you haven't already, make sure to subscribe to our channel for more expert health advice and cutting-edge research. We're here to empower you on your journey to optimal wellness. Thanks for watching, Health Warriors. Until next time, stay vigilant, stay informed, and most importantly, stay healthy.